Glasgow Coma Scale. The Glasgow Coma Scale, GCS, is used to describe the general level of consciousness in patients with traumatic brain injury and to define broad categories of head injury. The GCS is divided into 3 categories: 1 eye-opening, 2 motor response, and 3 verbal response. The score is determined by the sum of the score in each of the 3 categories, with a maximum score of 15 and a minimum score of 3. The 3 responses measured are: Best motor response, maximum score of 6. Best verbal response, maximum score of 5. Eye-opening, maximum score of 4. The lowest score for each category is 1, therefore the lowest score is 3, no response to pain plus no verbalization plus no eye-opening. A GCS of 8 or less indicates severe injury, 1 of 9 to 12 moderate injury, and a GCS score of 13 to 15 is obtained when the injury is minor. Grades of best motor response. 6 for carrying out request, obeying command, patient does simple things you ask. 5 for localizing response to pain. For withdrawal to pain, pulls limb away from painful stimulus. 3 for flexor response to pain, pressure on nail bed causes abnormal flexion of limbs, decorticate posture. 2 for extensor posturing to pain, stimulus causes limb extension, decerebrate posture. 1 for no response to pain. Grades of best verbal response. 5 for oriented, patient knows who and where they are, and why, and the year, season and month. For confused conversation, patient responds in conversational manner with some disorientation and confusion. 3 for inappropriate speech, random or exclamatory speech, with no conversational exchange. 2 for incomprehensible speech, no words uttered, only moaning. 1 for no verbal response. Eye-opening. For spontaneous eye-opening. 3 for eye-opening in response to speech, that is, any speech or shout. 2 for eye-opening in response to pain. 1 for no eye-opening. Presentation: A 64-year-old woman with hypertension was admitted by her GP after complaining of right-sided weakness. Over the next couple of days her condition worsened, and 4 days later she appeared to suffer a serious stroke, following which she was completely unresponsive. Tests confirmed brainstem death and permission were sought to switch off her life support. History. The woman had a 10-year history of hypertension. When she noticed loss of sensation and loss of power on her right side, she went to her GP, who had her admitted. Examination. Pulse was 80 bpm, BP 154/80, normal heart sounds. A positive Babinski sign was noted in her right foot. Moderate loss of power and sensation of limbs on right side. Weakness of right side of face, and dysarthria. Test results. No abnormal findings on CT scan or EEG. Progression: she showed no improvement of her right-sided weakness after admission to hospital. A small stroke was suspected, but no lesion could be seen on the CT scan. For days after admission she deteriorated. Her Glasgow Coma Scale rating was 3. She was totally unresponsive. An MRI showed a suspected brainstem hemorrhage and a small established infarct in the left parietal lobe. When tests showed brainstem death, permission was sought from her family to switch off her life support, and she died 6 days after admission.